record this meeting and we'll put it on our YouTube channel when we're done. So we have Dr. Kremkau and Dr. Gilday, and Mike's going to give an update or week. We're trying to just stay up, just weekly updates, even though not much is going on specifically with COVID. We just don't want to take our eye off the ball there. Happy to have the rural stations chiming in here and getting participating. And when this is done from Mike, then Messi will just have a quick operational discussion, and Van and Havel will lead that on North Station staffing. Okay, so Messi folks, please stick around after the docs are done. Okay, Mike, we're good.
All right. I don't have too much this week. You know, nationwide, there's still a ton of cases, and they're increasing in some areas, but a lot of the places that have large amounts of cases initially, those numbers are going down in cases per day. I think the nationwide total this morning was somewhere around 1.4 million cases with around 82,000 deaths in the United States. Some newer models are now predicting a lot of increases in rural areas. Not all of them, but I think that's just something for us to be looking out for. Not only do we have, you know, disproportionately low number of exposures that might confer any kind of immunity, but we also, you know, are relaxing a lot of social distancing restrictions and maybe are more lax on them than places that have, you know, higher numbers of cases. So just encouraging people to continue to practice all their social distancing. You know, I have mixed feelings about how beneficial wearing, you know, non-medical face masks are, but I try and wear one all the time when I'm out in public now, just so that anyone who knows who I am associates me with wearing a mask. So I've been trying to work on that. I would, you know, encourage us all to be wearing masks during our patient encounters, and, you know, hand hygiene is probably the most important thing, and maintaining those distances, that distance of 6 feet. So our highest risk for, you know, exposure to providers is going to be any of these aerosolizing procedures, and we should treat those all as a potentially infectious procedure and continue to wear a higher level of PPE for those. And be vigilant for potential cases. The other thing that's coming out, interestingly, is a group of sicker kids now with some type of inflammatory condition that occurs later in the illness. So be wary of, you know, sicker children potentially who've had known COVID or potential COVID. Again,
Like what do they look like when they have this?
It's looks like it's kind of a Kawasaki's presentation. So they'll sometimes have rashes, fever. They'll have petechiae, maybe some joint stuff. So they'll have pharyngitis as well. So just be looking for, you know, potentially sick kids. So I'm trying to think if there was anything else big I wanted to cover. I think primarily that's it right now. We don't have, you know, any hospitalized cases in Missoula right now. I've been busy the last several days with other stuff, so I haven't followed it quite as closely, thankfully, as I've usually been doing. I guess I'd open it up to any questions that are out there, or if Dr. Gilday has any big comments. So
I was trying to find, I thought I had received an email that was showing some, in the PEDS cases that you're talking about, some commonality in past medical history in those kids, but I can't seem to find it right now.
Yeah.
And I need to review that, and I can forward that on if I find it. But I thought I had received something that had suggested that there were some past medical history commonalities between these kids, but I'll have to find that.
Well, that'd be good to get out there, because I mean, it's something that I'm working tonight overnight in the emergency room, so I plan to do some reading on that specific topic, because I have just flagged some articles that I haven't read yet. So
right. And I know there was with Montana State, there was that program they were trying to work on high-risk kids throughout the state, and with chronic medical issues that was supposed to be helpful for all healthcare providers, EMS, all the way up through, docs and hospital staff. And I wonder if that might be useful for this as well, if there are these conditions that you find with these kids with COVID. So we'll have to work on that too. But
John, that's the tracking program. Is that the tracking program?
Yeah.
It's
Yeah.
like a map. Yeah.
Yeah. And as for the PPE, and I've kind of brought this up with both Sheriff's Office and with rural, is that definitely not a time to be sitting back on our heels. If we can do our best to try and get as much PPE as we can, still be diligently looking at those resources where we can gather that PPE, because I know everybody's going to be doing that, and not take this lull as a opportunity to just kind of sit back and rest, because we could see greater cases. And even if we don't see them in the next couple of months, once fall comes around, we're probably going to see a lot of resurgence of this. So we need, from my understanding at least, so I think we need to be working on that, continue to work on that hard.
Are there any updates or things that have been learned over the last couple of weeks about how COVID is presenting? That I know that the CDC updated some of their signs and symptoms. Is there anything that we should know about, new knowledge about how it looks in the elderly, in the adult population?
Yeah, I think the expanded guidelines, which include things like sore throat, GI symptoms, fatigue, shaking and chills without fever, those are all things we should be asking about. Exposure history is still important, and I think travel history is now going to be important to think about again, because if with relaxation of restrictions, we may start to see people starting to travel to Montana. There's a couple reasons too. I mean, people are looking at these maps of where that's the worst, and Montana's very low. So it's very possible that people with means or that have vacation homes in this area may start to travel here now, which could be a vector for more infections locally. And then with the weather being better in Montana, traditionally having a big tourism season starting soon, we could start to see, outside sources again. So I'd really encourage people to not neglect that travel history piece. I guess the other thing I would add too that I've been seeing is that I'm starting to see a lot more trauma, and particularly, ballistic trauma or stabbings. We've had a lot more penetrating trauma. I've personally taken care of 3 gunshot wounds in the last 2 months, which is way more than average, I would say. So I think potentially this is having a lot of psychological impact on people. And there's, certainly been a lot of thefts, and with law enforcement not potentially responding to in-process calls and releasing a lot of people who are with misdemeanor stuff, there may be a lot of issues with, violent crime and, well, crime in general, but particularly the ones that from EMS we should be concerned about is, substance related use and violence. So
Mike or anybody else, are we aware of any updates with the POV and just policies there? Anything that we should be, anybody's aware of?
Yeah, we're trying to do rapid testing for some of these patients so that they don't have to be hospitalized or, put up in the respite facility, because there's issues with getting people there. The health department is really a business hours organization, and a lot of these things are happening after hours or on weekends. So we're trying to avoid, initially they wanted us to hold all those people in the emergency room at St. Pat's until their test results came back, which with our volume starting to go back up now, I don't think that's realistic. So we're probably going to try and use some of the rapid testing to do that. So.
Questions for the docs? Mike, John, any updates on the efficacy of the testing, how accurate it is that we're doing here in Missoula?
I haven't heard any updates on the RNA test, but as Mike had mentioned prior, and still the kind of outlook on the antibody tests is I wouldn't lay much faith in those for diagnostic purposes, or do you have much immunity, or showing that you wouldn't be able to contract COVID again. I don't have much faith in those tests as yet. What about you, Mike?
I would agree. I think apparently 2 of the tests for antibodies are actually fairly reliable, but we still don't know what that means. And opposed to some other ways we use that testing, the IgM may not become positive, which again is the early antibody you develop in acute infection. So by having a negative IgM, in some diseases, we would say that you don't have an acute infection. I don't think we can say that right now. And we also don't know if having the IgG response, if that's a true positive, what that means as well. Does that confer immunity? So I think those tests are going to be important. And I think there's a couple good ones out there. Unfortunately, there are a lot of bad ones out there. So it's going to be, in my mind, it may be very difficult to put the data together we get from this. Smarter people than me are probably trying to figure that out. Right now, I wouldn't rely on, if people ask about antibody testing, my recommendation would be that you can get that test done, but we don't know what it means, and insurance is probably not going to pay for it. So take that for what you will.
What other questions do we have out there from folks? Kath, were you trying to say something?
I was just letting them know we're unmuted.
Buddy in the classroom there. Okay, Mike, so I just quickly, so you're talking about, just to review, you got the we're still concerned about the aerosolizing procedures. We're looking out for the potential of some sicker kids, paying some more attention to travel history, worried about some violence in the community increasing. And I have one last question. Do we have any issues with drop off at St. Pat's that you know of, or how are we doing right now as a EMS team? Anything that we need to know?
So I have from Lance recently, so things seem to be going well. If there's concerns, get those to me. Specific cases are helpful because then we can see what kind of factors led to the difficulty happening. So
great.
Again, trying to notify the emergency room early if you have a patient who's critically ill, or if there's a potential cardiac arrest coming to that facility.
Mike, question for you with the staff at St. Pat's. If they say room assignment on arrival, does that mean we go ahead and go in, or do they still want us to wait outside? That appears to be an issue sometimes.
I'll try and clarify that, but it should be that we're waiting for them to come get us from the bay. So.
Mike, during the last meeting, we had talked about this 14-day quarantine requirement for people coming back into the state. I think you were following up to make sure that we had an exemption for healthcare workers. Is that the case, or did you?
That's my understanding from the health department, but I've never received anything formally stating that from them. So that's what the CDC guidelines would say, because we're considered, critical infrastructure. So. I think continuing to do monitoring is important. And if you have symptoms, you need to notify your supervisor. If you develop them on shift, you should notify someone.
Great. Anything else? Any other questions? We got some city folks and rural. Any other questions that we just need to address here?
Hey, Dave Smith. Hey, how's it going?
Good.
Hey, McAvoy's trying to firm that 14, or Brad Davis is trying to firm that 14-day thing up with the health department today. I'll email you whatever we find, but that's still the main question.
Yeah, I wasn't able to be on that heat call because of training and other things going on. So sorry.
Dave, now that I see you on there, anything at city's end?
Everything's been pretty good here. We did have a breach in our PPE, and very helpful that the ERs can do that quick swab now as far as getting people back to work and knowing what to do with them afterwards. So that was a nice thing for us there.
Great. Anybody else? Mike, any last things?
No, I don't have anything else. Enjoy the weather.
All right, everybody. Thank you. Like I said, I'm going to record this. Well, it is being recorded. We'll put it on the Messy YouTube page, which you're all welcome to view. It's public. I can send that out if you want to get that link again. Dr. Gilday, Dr. Kremkau, thanks. Messy folks, please stay on, and we're just going to talk about some North Station staffing. Thanks, everybody else.
Thanks, guys.
Hey, Jason, are you there in the classroom? Can you tell me, is Vandenhavel or Med10 there yet?
No. They're not here, Dave.
Okay, they should be there in a minute, and that's what looks like Bob is trying to log on, but that's what we're waiting for right now, is just to go over some North Station staffing stuff. Does anybody else at Messy have any questions right now that we haven't addressed?
I don't believe so.
Okay. Oh, it looks like Bob said he can hear, not speak. All right, looks like he's just going to send something out. So
If he unmutes his audio, he can speak.
Bob, can you hear that? Can you unmute your audio on the bottom left there of your screen? Hey, John, while he's trying that, Ungaretti, do we have any PPE? How are we looking for PPE and stuff?
Actually, we're doing really good. Got a fair amount of gowns, face shields, gloves, face masks. We even got KN95s in. So the thing we're a little short on right now would be the Sandy wipes, but I think we just got 4 cases of those in. So we've got pretty much everything anybody would need, including the airway filters. We got lots of those too.
Okay.
If Bob is on a laptop computer, if you hit the space bar, that unmutes it.
Okay, I'm texting him as we speak. Bob, can you talk now? We'll give this another minute, folks, and then we'll break. Sorry. Let me just see if I can get this to work for Bob. And we'll
The other thing he would have to do is enable his audio.
call him here.
Dave, next to the stop video thing, there's an up arrow. If you click on that up arrow, you can change the settings.
Yeah, I think he just said his mic wasn't working. So Bob's gonna send out a thing by 5 o'clock this afternoon for everybody about staffing at the North Station. There'll be some fairly significant changes. So just expect that by the end of today. Again, if nobody has any questions, we'll end the meeting here. I'll post this to YouTube. And thanks everybody for joining.
Thanks, Dave.
Thanks.
Okay, we'll see ya.